Looking for natural strategies to treat PCOS? Berberine could be a great option. Keep watching because in this video, I'll break down how berberine helps polycystic ovary syndrome at the root cause by regulating insulin, balancing hormones, and melting inflammatory belly fat. Researchers asked 657 women if your PCOS could be safely and effectively helped by something other than fertility drugs or birth control pills. Would that interest you? Unsurprisingly, 99% of them said yes. If you have or suspect you have PCOS, and you'd also respond with an enthusiastic yes, then you're in the right place. Because in this video, I'm doing a deep dive on a natural compound that has been shown to do just that, helping you balance your blood sugar, drop visceral fat, promote fertility, and reduce common symptoms of PCOS. But first, you need to understand what causes PCOS in the first place and how to know if you have it. Though PCOS continues to be underdiagnosed, anywhere from 15% to 20% of females meet the criteria, making it one of the most common hormonal disorders among women of reproductive age. Common symptoms of PCOS include oily, acne-prone skin, especially around the chin and jawline, weight gain, especially in the abdominal or belly area, thinning of hair on the scalp, abnormal hair growth on the face or body, irregular, absent, or heavy periods, and infertility. In fact, PCOS is one of the most common causes of infertility in females, which is why many women aren't diagnosed until they try to get pregnant. To be diagnosed with PCOS, a woman must have at least two of the three following symptoms: irregular periods or absence of periods due to lack of ovulation, ovarian growths that are seen on ultrasound. Interestingly, while most people assume that these are cysts, they are actually immature ovarian follicles that have stopped developing. High levels of androgens in the blood, or signs of high androgens, such as facial hair or dark hairs on the body. This is a tricky one because you can have excess androgens without having high testosterone, or DHEA, on a blood test. This actually happens a lot. One of my clients, who'd been struggling with PCOS symptoms for many years, told me, "I've been to a few doctors, all of whom have agreed that I may have PCOS, but when I'm sent to a specialist, it's determined that I don't have at least two of the three qualifications to be deemed as actually having PCOS. So they say not to worry about it and send me on my way." As it turns out, androgen metabolites like androsterone and 5-alpha-DHT can also cause PCOS, but these levels are often missed by conventional testing. And these androgens can be even more problematic. They can bind more strongly to androgen receptors, and they are 3 times more potent than testosterone. That's why I always recommend the Dutch Complete Hormone Test to determine the best way to address PCOS. It's an at-home urine test that not only measures reproductive hormones, including progesterone and 3 estrogens, but it also measures half a dozen androgens, which has been super helpful for many of my clients who are seeking concrete answers. I'll put a link to order your Dutch Complete Hormone Test kit in the video description. And I'll even help you interpret your results and come up with an action plan that works on the root cause. All right, now that you know what PCOS is and how to figure out if you have it, let's talk about how berberine can help you treat PCOS, particularly how it can help you lose some belly fat, regulate your blood sugar, and balance your hormones. Women with PCOS tend to have insulin resistance, where their cells no longer respond appropriately to insulin even when the pancreas is producing adequate amounts. Desensitized insulin receptors result in glucose not being allowed into your cells. When this happens, you have higher insulin and glucose levels in the bloodstream, which is problematic for many reasons. Specific to PCOS, chronically elevated insulin can cause the ovaries to make more androgens, which can worsen PCOS symptoms like face and body hair growth, scalp hair loss, acne, oily skin, and fertility problems. Insulin resistance also causes fat gain, particularly fat accumulation in the torso and around the midsection. Berberine has been particularly well studied for its ability to keep blood sugars and insulin levels from being too high or too low. Instead, it keeps them in the range of just right. When your blood sugar stays balanced, it not only helps your body burn stored fats, but it helps prevent type 2 diabetes, high blood pressure, and elevated cholesterol. Berberine activates a regulatory complex called adenosine monophosphate kinase, or AMPK, which is known as the master metabolic switch in fat and muscle cells. This improves insulin sensitivity and reduces fat accumulation. Berberine also boosts your body's production of glucagon-like peptide 1, aka GLP-1. When your body makes more of this peptide, especially after you eat, it helps promote insulin sensitivity and lower blood glucose. This is why GLP-1 agonist medications like Ozempic were originally developed to treat type 2 diabetes. By supporting GLP-1 production, berberine also improves satiety, or the sense that you've had enough to eat, by activating certain areas of your brain. That's why it can also help lower appetite and food cravings. A recent clinical trial of over 100 patients with type 2 diabetes found that 500 milligrams of berberine taken for just 12 weeks lowered both hemoglobin A1C and fasting glucose. But does it work specifically for women with PCOS? Well, research suggests that it does. One study of women with PCOS and insulin resistance found that those who took berberine significantly decreased their fasting glucose, fasting insulin, and cholesterol compared to placebo. And when compared to metformin, a common pharmaceutical used to treat PCOS and insulin resistance, those who took berberine lost more inches around their waist, which is one way that researchers measure belly fat. I'll put a link to my favorite practitioner-exclusive berberine product in the video description, so you can order it through my Fullscript dispensary. And I'll talk more about this later, but this specific supplement has an extra ingredient that makes it particularly helpful for PCOS, so be sure to check that out. All right, back to belly fat. There are a lot of terms that are often used interchangeably to describe fat accumulated around the midsection: abdominal obesity, central adiposity, and visceral adipose tissue, or VAT. These terms are all trying to describe the same thing: the inflammatory fat surrounding the organs in your abdominal cavity, including your liver, intestines, and for females, the reproductive organs. Research has found that too much of this type of fat in this specific location increases your risk for a whole bunch of diseases like heart disease, diabetes, dementia, non-alcoholic fatty liver, and even breast cancer. And excess belly fat is a common symptom of PCOS. You might think you know belly fat when you see it, but people get it wrong all the time, even doctors. It's actually pretty easy to confuse subcutaneous fat with visceral fat. Subcutaneous fat is underneath the skin, typically distributed evenly around the midsection. It's the type of fat tissue that you can pinch between your fingers. Visceral fat lies underneath your abdominal muscles. An easy way to distinguish between the two is to flex or tighten your abdomen, perhaps by lying on your back and starting to do a sit-up or a crunch. Then see how much of the fat around your waistline is pinchable. This is subcutaneous fat. If instead of a layer of soft tissue, you feel your abdominal muscles contract and you still have a fullness or roundness underneath hard muscle, that's a good sign that you're dealing with visceral fat. It's not a perfect test, and while most researchers rely on hip-to-waist ratio to determine central adiposity risk factors, I found it can be helpful for distinguishing between subcutaneous fat and visceral fat. Most people who are struggling with extra fat around the waistline have a mix of both, some visceral fat and some subcutaneous. The good news is that berberine can help with both types of belly fat, including in cases where PCOS is a cause. In a 2021 study, female patients with newly discovered PCOS took 550 milligrams of berberine twice daily for 2 months. This study found a decrease in BMI, visceral adipose tissue, and overall fat mass. And a literature research of 5 studies, including 1,078 women, found a significant reduction in visceral fat and an improvement in insulin sensitivity when participants took berberine. The third way that berberine helps relieve PCOS symptoms is by improving hormone balance. Remember that in women with PCOS, androgens are usually elevated. When this happens, it impairs ovulation because ovarian follicles don't develop properly, and glucose uptake in the ovaries is disrupted. And insulin resistance, which is the most common problem driving PCOS symptoms, makes you more likely to use the 5-alpha pathway of androgen metabolism, which results in excessively potent androgen metabolites like androsterone and 5-alpha DHT. By promoting insulin sensitivity, Berberine helps lower the impact of high androgens by shifting away from the 5-alpha metabolism pathway, which also means it supports healthy ovulation. A study of 150 women with PCOS who were undergoing fertility treatment found that taking Berberine prior to IVF improved the pregnancy outcome, achieving more live births with fewer side effects than metformin. And remember that literature review I mentioned earlier? Well, 3 of those 5 studies showed an improvement in ovulation rate with Berberine therapy. You know what else can reduce 5-alpha metabolism, supporting hormone balance in PCOS? Epigallocatechin gallate, or EGCG, from green tea. And it just so happens that my favorite Berberine supplement includes decaffeinated green tea extract. Like I mentioned, you'll find a link to this practitioner-exclusive Berberine in the video description. I'll also include a link to my free PCOS support checklist, a downloadable resource with other functional medicine strategies for treating PCOS and relieving your symptoms. So be sure to check that out. And if it's your first time trying Berberine, I've got another video all queued up for you after this one that explains exactly how to take it, including suggestions for dose, timing, and duration. So be sure to stick around for that one next. If you're struggling with symptoms of PCOS, I want you to know that even though it may feel like it, you're not alone, and you do have options to find relief. I'm rooting for you. I hope you found this video helpful. Thanks so much for watching and for supporting my channel. It might not seem like much, but every like, subscribe, and comment helps someone else find the functional medicine strategies that they need to get relief or prevent health problems down the road. And that's pretty cool if you think about it. So thanks again, and we'll see you in the next video.